Thank you very much, Mr. Chairman. Let me just underscore the importance of marketing. I was just with the head of Connecticut's exchange, one of the most successful in the country. This week, we will know whether our insurers are staying in for the next enrollment period. And the folks that run our exchange couldn't imagine a worse time for the president to have announced the dramatic rollback of marketing. Even though we do a lot of it ourselves in Connecticut, we rely on those national marketing campaigns as well. And at a moment where at least one of our insurers is right on the precipice of walking away, this announcement may be the straw that breaks the camel's back. I followed Senator Young out following his question about how you make sure that any federal assistance on setting up reinsurance funds doesn't become a permanent burden, extra burden on federal taxpayers. I understand that to be a very legitimate concern that many of our Republicans will bring. And I just suggested to him, and I'll suggest it to you and leave it for the panel to think about, that maybe there is a way to place a bet that the cost savings that Alaska has achieved will be achieved in other states, but do it in a time-limited fashion. If the savings are not achieved after a period of several years, that the federal contribution claws back. That may be a way to protect the federal investment while recognizing that states may not be able to make these investments up front. So maybe there is some middle ground where we can recognize that helping states set up these pools is important, but protecting taxpayers are important as well. I just have one question, and it's frankly to maybe be a little bit of a devil's advocate on a concept that I actually support, which is state-based reinsurance, perhaps backed up by the federal government. And I want to ask this of Mr. Tyson. Your whole business model is built upon accountable care. And we've spent a lot of time talking about the importance of building a system of insurance and a system of reimbursement based upon getting insurance companies and big physician groups and hospitals to care about outcomes. One of the risks of taking off of insurance companies the cost of very highly medically acute patients is then it then doesn't put the risk on patients who don't get preventative health services and who spiral out of control into the highest 5 or 10% of spenders, takes it away from the insurance company. So as a representative of a company who thinks a lot about how you build accountable systems of care, imagine a world in which we do have a state-based universal system of reinsurance. How do you make sure then that insurance companies who would still be providing the care for everybody else have an incentive system in place to make sure that they just sort of look the other way as somebody gets really medically complex because they don't have to worry about it on the back end?
It's a very, very good question and very thought-provoking question. Just to preference my comments by saying that I think it's just an excellent question. It goes back for me to the earlier conversation we had this morning, which is if we're not dealing with the delivery system, the reform of care itself, while we can watch costs go down on a temporary basis if we're focused on the claim side or just the coverage side, sooner or later they're going to have to access that system of care, and that's going to ultimately drive the cost of care back up. So really figuring out how to bring the two together, which is both the coverage and the care aspect, and to create an accountable system is going to be critically important in the long run for this to be successful. Added to that would be how do you make sure that you are incenting the system to perform the way it is intended to perform, which is to take those individuals at high risk with the illnesses as we described, but really to make sure that their care is being provided in a way that it manages the cost in the long run. That's critically important.
And how do you do that if you're not responsible for it financially?
Well, you want to create that financial linkage to the delivery system. We have it in Kaiser Permanente because we provide the care and the coverage under one roof, if you will, the model itself. Over time, you want to build those kind of mechanisms with that high-risk pool against the provider population as well. I know we did not talk about that today in the proposals, but it is something for the long term that we would need to solve to, or you're right, no one will own, if you will, the cost of care for that high-risk population.
Thank you, Mr. Chairman.